Hi, my name is Harishan Thamaraja and I'm Monash University's Curriculum and Assessment Lead for the General Practice Program. At Monash University, we believe that great doctors begin with great mentors, and that's why we're inviting enthusiastic GPs across metropolitan Melbourne to join our medical student teaching program. We believe that it's a great way of shaping the future of general practice, and today we'd like to show you some stories from our GP colleagues. We hope that you can join on this journey with us, and we look forward to welcoming you. Thank you.
Hi, I'm Claire Dinas and I've been a GP supervisor for about 9 years.
My name is Pradeep Vijayanand. I've been a GP supervisor for well over 15 years now. I like the fact that having a student is very fulfilling and rewarding.
I like the opportunity to pass on my knowledge and some consultation skills to the next generation of doctors.
I had more opportunity for deep reflection with the student. There was deep learning, an opportunity to understand medicine again from first principles, which I really enjoy. So it was almost connecting back to my university days.
I really like having the opportunity to showcase general practice as the wonderful career that it is. Doing that, I'm doing my little bit to try and address some of the workforce problems that general practice faces. When you're teaching on a subject and when students are asking you questions, I think it's really important that you're up to date. So it's a good way of getting your CPD points and making sure that you're practicing according to evidence-based guidelines.
For the students, it's a very immersive experience, so they learn by being real in a real world scenario.
I've currently got a fourth year student who's excellent, incredibly competent and confident, and I feel very comfortable actually with her taking history from the patient initially in a separate room. That would give me time then to do maybe some telehealth consults, do some admin, and then she would come back in and we would see the patient together. So potentially it can actually be a more efficient way of consulting. I certainly don't feel that I run behind, and I know that people might be concerned about that, but that's not been my experience.
And clearly patients are happy to have students, so I feel they do benefit from it as well. So it kind of eases this tension for sometimes patients might think, well, I'm happy for the students to see me, so it is beneficial all around.
Students often spend a bit more time with patients perhaps than I've gotten. I've certainly learned things about my patients from the students that I didn't know, maybe things about their social history or their past medical history. And then I think there's advantages for the whole practice. It's an opportunity for other people that work in your practice to become involved in teaching. And I've particularly got one practice nurse who really enjoys teaching the students as well. And then of course there is the practice incentive program, so there is some financial remuneration for practices that take part in medical education as well.
It's definitely fulfilling, it's rewarding. It gives an opportunity for growth as individual GPs, and also it opens an opportunity to be a part of the academics of medical education. So it's a whole world out there.
I would really want to encourage them to give it a go. I've never regretted it. I've genuinely really enjoyed having every student with me. I've learned things from them, both about medicine and about myself. If you're interested in medical education, it's a great opportunity to improve your skills as an educator as well. So I would really encourage you to give it a go if you're thinking about it. You won't regret it.